I became a doctor because I like helping people. My father was a doctor, my mother was a nurse, and I think basically we were destined to become a doctor. I like taking care of people. And so I actually started out becoming a surgeon like my father, and I learned how to use my hands, and I'm very good with surgical techniques. But I didn't get chosen for the program I wanted to get into, so I went into anesthesia. And I became very good at anesthesia. But in my last year in residency, I got a chance to do pain management. And what I found is I got to balance the things of taking care of individual patients with some surgical skills that I had. I did some of the original studies for failed back syndrome for 2 of the big manufacturers. I've done studies for intrathecal opioid medications. I'm considered probably one of the leading experts in microdosing of intrathecal opioids, and I've talked in the national level for that, and people now come to me to learn how to do that. It just kind of fell into my lap that I could take care of people. As one of my surgical mentors would say, I had that ability to listen to people and to find the reasons for people having pain and to actually be very good at what I do. But one of the techniques that everybody uses and what you should be able to use is start to tell them their story back and answer, okay, yep, you actually get it. And so one of my favorite techniques when I'm talking to a patient is, okay, this is what I heard you tell me. Is this what really is happening? And okay, is there anything else? Like, okay, when I'm taking care of a person with a headache, okay, how's your back pain doing? What do you mean? I didn't tell you I had back pain. How did you know I had it? Or patients will come in with back pain and go, okay, how's your headaches doing? Because I can tell by the way they're sitting that they have a headache. So you get used to looking and saying, okay, what is it that's different about this person? What can I do? And how can I get them to come out of their shell to tell me the entire story? One of my favorite things is I can tell patients, I could probably look down the pew at the church and say, okay, that person's got this pain, this person's got that pain. I can watch how you walk and tell you if you got pain. I can tell you where your pain's coming from. So the fun part about this is when you listen to the story, you get to actually kind of be a portion of that person's life and say, this is what you're feeling. And you got to feel for that patient. They got to have a sense that you actually do hear them and that you understand that they're actually really in pain. Being a doctor is your job, it's not your life. So outside of this, again, I like activities. I like playing golf. I like biking. I like doing those things. I like going to plays and theater with my wife or going out to dinner with her. We like traveling. Go back to see our families in Albuquerque, go up to Colorado to see the snow and the leaves change colors. We're planning a trip next year to do 2 weeks of just driving around the country to see different sites throughout the country.